I'm making this short video so that a lot of my juniors have some insight of what exactly happens after the first MBBS. So students who are there in the first MBBS or then third minor, I feel the video is for you. So recently when I'm about to be relieved for my preparatory leave for MD final exams, we receive a first batch who have just passed their first year, have very less clue about what is going to happen in their posting. It was their first posting and a lot of them had different questions. So I feel that I should address those topics which I am anticipating, and then I'm going to tell you about those things, how to tackle them. And anything, if you feel that I have missed it or you have a new doubt, you can message in the comment box. So in this video for the first student, I'm going to talk about three important things. The first thing is going to be the postings, second thing will be your curriculum, third will be your some idea or strategy about a NEET PG preparation. So when we talk about posting, I feel that going back and then having an idea, the most important part about my curriculum, about my 5.5 years of MBBS was postings, I feel, because that is the most important thing. It is very important that you get early hands-on. It is very important that you get to know what exactly is being operated in your government hospitals, what exactly is operated in the private hospitals, or you get an idea about how to examine patients, you get to see the clinical findings, and this is what builds up a visual memory, and this is what makes you something different from the others who are just reading books. So ideally you're supposed to see patients simultaneously, read also. So that is going to be the best way. If you try to skip your postings, you're going to lack at a significant level, and then since the method of recognizing you, or the method of examining you, is becoming more and more difficult and becoming more of an OSCE pattern, I feel that clinical posting is going to be a very important part of your MBBS. So when you talk about postings, I have few things to talk about. The first thing is, I always tell students to carry a pocket notebook, so that when you attend the rounds, you write down all the important cases which you see. When you attend the rounds or you see the OPDs, you write down few drugs which you see at the first time, so that when you go home, you can read about those drugs, you can read about the conditions which have been taken at the rounds. The other thing is that you can write all the small things which you don't understand, so that you can pick up a professor or a student or a resident, so that you can discuss among yourself and then find it out why did you not understand that part, and you can be clear more about that. So the first thing was about the pocket book. The second thing is going to be your app. I feel that during my MBBS days, I used Medscape a lot. Medscape is a very small application in your phones, and I feel it has significant good amount of information of the drugs. It also has a drug interactor. The other thing is, it has a good amount of information about the basic conditions and significant. For example, if you are visiting in the ward and you have a case of alcoholic liver disease with hepatorenal syndrome, you can type hepatorenal syndrome. You will get a significant amount of pathophysiology, summary, the epidemiology and treatment also. Then you will have some good idea in a quick time, so that you can see it. So after the pocketbook and the Medscape app, the third thing I feel is about the books. So talking about medicine, I feel that one should read Hutchinson's Manual of Clinical Medicine as the first book. Apart from that, when you talk about an Indian author where you have a similar book with good clinical examination, you can use the book Clinical Manual by Dr. Achit Bulur. And if you feel that you want to prepare for the vivas, which I feel should be taken at a level when you are in third minor and third major, I feel that the book by Dr. Kundu is a good manual to read for your exam point of view, or else examination point of view. I feel Hutchinson's and Dr. Bulur's book is okay. When you talk about this, if you want to dedicatedly excel more into neurology, so I feel that if you are very interested, then only go with the Bickerstaff Manual of Neurology for examination, or else I feel Hutchinson's will do in MBBS. The other thing when regarding surgery is that ESDAS is a very well-known book and a common book which students use, and apart from that you can polish it up with the notes which you notes or cases which you present in your surgery postings. The third part is about pediatrics. I used Lakshan Swami, which is a very excellent book and commonly used by most of the students. And the fourth part, in OBGY we have a lot of deficiencies in the part of practical books, but the book by Dr. Ajit Virkud is one of the commonest book which is used. So apart from the books, the most important thing I feel is about the ECG. So when you see a lot of ECGs, I feel that this is one source of reading ECG which I found in my residency in second year. So this is a website called as ECG by Fastlane. So when you type the website, you go there and then you see there are very simple basics of ECG, including what exactly is the P wave, what exactly is the QRS complex, S wave, and they have compared a small things, basic PR interval and all. I feel this is a very significant source to read ECG. I don't recommend reading Balthazar, his book of ECG, for you at this stage, which I feel should be read only when you go to the residency. But for building basics, even at this time, I read ECG by Fastlane, because they have given a lot of examples and offer all the small findings, and it is very easily accessible and very simple to understand. So we are done with 4-5 things. The other thing which is very important for me, which I have been doing from my UG days, is that make your own collection. Make your own collection of ECGs, make your own collection of X-rays, make your own collection of photos of instruments or procedures being performed. Have a look at an ascitic tap or paracentesis being performed. Have a look at thoracocentesis or a pleural tap being performed. Have a look at lumbar puncture, bone marrow biopsy, bone marrow aspiration being done whenever the resident is free. Observe a good intubation, observe central line insertion, so that you get an idea about when you observe those procedures, you indirectly get about the procedure of the procedure. Apart from that, you get indications, contraindications about the procedure, so you get a fair enough idea. And when you see those drugs being applied in the emergency setting, in the routine settings, you get an idea of how to answer in the exam. So when you are in the viva, when the professor asks you that what is the indication of atropine, so there are emergency indications and then there are few other indications, so you will come to answer those when you see those. So make your own collection of ECG, X-ray, CT, MRI, photos, everything, so that when you revise for your practicals, you have your own collection of instruments, so it is very quicker to revise. The second part about the curriculum, I feel, is very shortly, I feel, is that patients, a lot of students miss out on this, is that you use standard books. So the first thing about pathology, which I feel is one of the most important subject in second year, you start with Robbins and Cotrans. So this is an excellent book, internationally used book. Robbins and Cotrans should be used, and a lot of people don't know that there is a review book by Robbins and Cotran where every chapter wise they have given MCQs. So when you read a chapter, for example apoptosis or cell necrosis or whatever topic which is there, or a topic of myocardial injury, so there are MCQs based on those topics, so that you can revise in an excellent way, and all those MCQs are case based. So that builds up a clinico-pathological correlation itself when you are reading pathology from review of Robbins and Cotrans. So this is done for your pathology. When you read about pharmacology, I read a lot about pharmacology mainly from the KD Tripathi book, and some other books are there which I feel that at stage you should not be putting up more energy on that. And the third subject, the main subject, microbiology, I felt that I have read a significant amount from Apurva Shastri, and apart from that, and from Anant Naran. So this was about your postings and your curriculum. The third part about NEET PG preparation is that when I was in my third minor 6 years ago, I got a fair enough idea how to prepare about NEET PG, and then I started my preparation around approximately in third minor. I used to read standard books in first and second year, and then I started my preparation in third minor. That was the era when 6 years or 5 years ago people used to start preparation in third minor. 2 years ago, I feel 2 or 3 years ago, since 2 or 3 years ago, a lot of students have started preparing in the second first itself. That is because I feel that students are less interested to put a lot of time into their lectures, and they prefer to see Marrow lectures or the app based lectures instead of doing that. It has its pros and cons, but I feel that from second first you should get an idea. You should buy a subscription. I have used Marrow. I have good reviews, and I have been benefited that. I am using the same for NEET SS. So I feel that for you should buy a subscription, get an idea. For example, when you are starting pathology, when you read about a topic, I feel if you have time, significant amount of time, and you are trying to read, you can revise from Marrow and then add those small important points to your Robbins. Use it as a way to revise, so that and you get an idea how an MCQ exam is there when you are going to complete your 5.5 years of MBBS. So you get an idea, you be in that stay, and when you are going to prepare, you are already in that loop, and you get to know what are important points according to as per NEET PG, and then you keep them aside so that you revise them later. So apart from these things, if you have any doubts, I feel that you can you feel free to message me on the group or on the YouTube channel, so that I'll answer them